So at the moment, our goal is to have Mr. Cohen going back to his normal daily life activities. So we're just doing 1 hour and a half sessions, but like really focusing on exercise that will make him stronger and more confident on like, walking on the street, going home, doing stairs, sitting, standing up, and all this kind of situation that Mr. Cohen was struggling before doing through the procedure. Well, definitely after total hip replacement, there's a lot of elements and a lot of things that you need to be aware of, and you have a lot of limitations about like range of motion, even simple motion you can do during the day, like sitting. You cannot really use like lower seats in order to avoid problems on the new hip. Mm-hmm. But with Mr. Cohen, with this procedure, was quite able to do all of these things with no issues at all, no limitations. Okay, maybe he was struggling a little bit with strength first, but he actually went through it very well in a really short time. Well, I can tell you that a patient with total hip replacement at first during the rehab process, you have a lot of limitation and some situation that you need to avoid with them. You have to teach them even simple motion that they do during the daily life activities. They might struggle and they might have some limitation because they need to avoid eventual damage on the new hip. But with Mr. Cohen and his new procedure, we actually went through directly to the exercise that were really effective on his daily life activities in a shorter time, and we really had no limitation in terms of range of motion, in terms of strength. So it was just up to him, up to the patient, not really up to the surgeon indication. Total hip replacement is also related to the goal of a patient. So you might have some patient that just needs to be able on the daily life activities, and that might take like even 3 or 4 months in order to be like super confident on that. Or other patients that they need some more like sport activity, and those may take even longer, so even 6 or 8 months. Okay. But with Mr. Cohen, we kind of reached the same level of activities he was doing when he was feeling healthy and pain-free before the surgery, before the procedure, and he made it in 1 month, 6 weeks. Mr. Cohen had a little bit of issues on the hip flexors muscle, but that's related to the fact that when you have hip pain, you usually, before doing anything procedure or any surgery, you usually go for a long time suffering with pain. Yeah. So like even some bad posture. So I think his pain he had in the hip flexors were more related to that bad posture he had. Yeah. But he actually kind of resolved that pain in a really fast way after the procedure. Well, surgery is a surgery, so you always have to deal with scars. You have to deal with hematoma after surgery. So in the first month, you're still like in acute phase and you need to take care of it. Yeah. So definitely, if you need to compare the two procedures, a total hip replacement, you're losing 1 month because of the acute phase. Okay. But after a simple injection, you're going straight to the exercises in a few days, 1 week maximum.